A fracture is not a fracture is not a fracture. The fracture treatment varies with a person's age. It varies with the area of the body. It will really start to vary if the individual's involved in a severe trauma in which the bone is then exposed to the outside world and will require a multidisciplinary approach with perhaps orthopedic surgical treatment, the employment of antibiotics, and multiple surgeries with possibly the placement of metal plates and screws or external fixators, which looks much like a tinker toy device to treat the fractures. At the front end of fracture treatment with pediatric patients, oftentimes we're concerned with different issues such as the possible injury to pediatric growth plates so that young people don't develop with subsequently with a deformity of the hand or the upper extremity or lower extremity. Uh, at the other end of life, we tend to be more aggressive with fracture treatment in adults because we want to, it's important for older people to be mobilized and get up and about so they don't develop medical problems such as blood clots or pneumonias. So the fracture treatment philosophy is a little different. As I mentioned before, in traumatic patients, there may be multiple surgeries involved in the treatment, and it may take several months to get subsequent fracture healing. So the fracture treatment differs with the age group, differs with the area of the body, and it differs with the exact kind of fracture that we're dealing with, all of which we can handle, or we have subspecialists within our group that specialize with different age groups.